Good afternoon, everybody. This is Robin Heron, your carnivorous grandma here. I am introducing a new series called Carnivorous Grandma Speaks, and I'm very excited today to be talking with Dr. Tony Hampton, who is a family physician and metabolic health doctor. So I'm going to pop him in here and we'll let him go ahead and hey, Tony. Can I
Yeah,
call you
happy.
Tony or Dr.
Yes,
Tony or Dr.
Tony.
Hampton? Or all
Tony
right,
works. I'm good. We're family, so
awesome.
we're good.
Yes. So welcome to Carnivorous Grandma Speaks.
Yeah,
And
absolutely.
I'm so excited to have you here. So thankful that you decided to go ahead and take up my offer to be interviewed on my channel. I have lots of questions for you. And certainly if anybody in the chat has questions, they can post those as well. But can you just introduce yourself?
Absolutely. Happy to be here, by the way. Appreciate what you're trying to do. We have the need for a lot of voices, not just in the carnivore space, but in nutrition space in general. And some of the most engaging ways to do that is by having testimonials. So your whole life and your story is a testimonial. I have the benefit of a testimonial plus seeing what happens to my patients. So I'm loving it. But I am, as you could imagine, a conventionally trained family doctor. I got some additional training in obesity medicine. And at some point in my career, I became frustrated that patients weren't really healing based on my conventional disease management approach. So that sparked my interest in doing a little research. I eventually got a master's in nutrition and functional medicine, and functional medicine is a little different than conventional medicine because it's holistic. It covers the spectrum of the entire physical, mental, emotional, spiritual of the patient, and looks at factors that we typically don't look at in conventional medicine, like maybe their genetics,
Mm,
their family history, their hormones, things like that. And when you do that, you are able to harvest the root cause of why the person in front of you may be sick. And that's a model I think all doctors should take on. And I'm hoping that that happens in the very near future. So that's my background. Very happy to be here and share my thoughts on a few whatever comes up.
awesome. I'm so thankful, that we have physicians out here who are actually studying nutrition.
Yes.
Because what I understand is in the physician world, I don't know, as you guys are getting your education, the nutritional education is pretty small relatively to all of the other things that you learn. And just we see what's happening in society with our metabolic health. We can see it as we look all around us,
Mm-hmm.
everywhere,
Mm-hmm.
that people are struggling with their metabolism and being
Mm-hmm.
able to metabolism the things that we're eating, metabolize the foods that we're eating. So I'm thankful to you for being one of those doctors who has taken the opportunity and the time to spend to learn about nutrition and other ways of doing things, um, rather than just throwing a pill at it every time.
Yep.
So I really do appreciate that. I do have a couple of hellos. I just want to just pop this in here really quick.
Yeah. Let's do it.
FR Humphrey says hello, Robin and Dr. Tony. Hi, FR Humphrey. And then we have Copper's Carnivore Kitchen. Greetings from Alaska. Thank you for being here, Dr. Tony. And I do echo those sentiments as well.
Amen. Amen.
Margaret Smith is saying, I just love this. And I do too. And I have a ton of questions. So I'm going to actually, we do have one question in the chat. I'm going to go
Yeah.
ahead and start with her question.
Let's do it.
Lisa Lopez is asking, can carnivore help at all with OPMD? And I don't even know how to say it. Sorry.
Ah, don't worry. That's why they pay us the big bucks, right?
Right.
This is not something you see in clinical practice that often, as is the case for those rare genetic conditions, oculopharyngeal muscular dystrophy, right? So, but people who get this, they'll have muscle weakness, particularly around their upper eyelids, and that's one of the ways you'll kind of know they have it. It can affect their throat. So it's a condition that is, I think it can affect your vision. So that's where the
Mhm.
ocular comes from. But so so these are challenging conditions, right? So the question is, does it help to have a carnivore diet? And the answer is yes, but keep in mind, the reason for that is because with a highly protein diet, right, you're going to then give your muscles a chance, right? And what's also good about this type of diet is that it's so the opposite of autoimmune conditions, that it helps those things. So although this is more genetic, the benefit will be there. But this is a challenge. I don't think you'll find that a carnivore diet is going to, reverse this condition. But to the extent a person's getting therapy and trying to get, stronger, you need to have the building blocks to do that. So that's why I think this would benefit a person like this, and it would be an experiment. You'd say,
Mhm.
okay, let's see if I try this for 6 months, do I see an improvement in muscle strength in the areas that have been impacted? So that's how I would frame my answer around that question.
Awesome. Thank you so much for answering Lisa's question. And Lisa, I hope that helped you. So I just want to talk a little bit about you and see how, did you have any issues with weight? Did you struggle with your health or anything like that? Or what led you to the diet that you're on now? And what kind of diet are you on now?
Yeah. Well, first of all, shout out to all the people who have struggled with their weight. I am not one of them. so, so I've never, in fact, when I was younger, I used to always get teased for having these skinny legs. I guess, and it's also true, my wife had the same problem. I look at those old images of me and those skinny legs. So weight's never been a problem. Ironically, it's been a problem in my family when you look at other family members. So for me, it was all about my stomach, and that's what kind of got me interested in different diets. Now, having said that, the plant-based diet is where I started, and probably around 18, 19 years ago is when I started that journey. Again, just looking for what's the best way to keep my kids healthy?
Yeah.
What's the best way to keep my family healthy? And when I went down that rabbit hole, it led me to a plant-based diet. And I kind of stayed in that rabbit hole for about 7 or 8 years.
Mm.
And I did feel better when I ate a plant-based diet. I also felt a lot of, gassiness and stomach irritation. And I just assumed I didn't take enough Beano. There was something going on with that, right?
Yeah.
So later on, when I found that I wasn't really optimal, I later then moved towards, after doing research, a more low carb dietary pattern, which I adopted. And when I did that, and that transition to keto, I absolutely felt better. The mental clarity was off the chain. My sense of well-being was amazing. I was able to focus better. I didn't think about food that much, right? But I still found that when I would eat those vegetables, my stomach would still get irritated, right?
Hmm.
So once I saw people I respect in the low carb keto community, rather it's Dr. Ken Berry, Dr. Anthony Chafee, and others, Dr. Kiltz, I was like, you know what? I respect these guys. They're my colleagues. Maybe I should at least try it. And then when I moved towards more carnivore, I found that's when I was my optimal. So I would never tell anybody checking this out, you need to do carnivore to be optimal. What you need to do is an experiment. And if you find that certain foods don't make you feel optimal, then you may
Yeah.
want to remove those things from your diet. So I'm basically a carnivore, uh, periodically a ketovore, depending on, again, what my wife made. And if she insists, you guys are very convincing at
We
times.
can be.
And if it's something I don't have a history of having problems with, like green beans, I may indulge. But I go weeks and weeks without eating vegetables. and I don't think I've had one in a month probably. So it's totally, and I don't feel like I'm missing anything. It's been nice to find something that really works for my body.
I am so in agreement with you. It's, I did keto as well. And I found that it just was not sustainable for me, I would say, because I faced carb cravings. Of course, I had a weight issue pretty
Yeah.
much my whole life. Um, and I was just doing a video the other day, and I was like, I forced my weight down through a variety of different diets, and that's how I appear to be, not having a weight problem. But the feeling of general generalized well-being and the feeling of self-control, not always thinking about food, that kind of thing is those are benefits that are really, you know, those are things you have to see it for yourself to believe it, actually. Like how good you're going to feel when you try even a keto or carnivore diet. That mental clarity is like everything. It's amazing. I think you went mute, Dr. Tony. I cannot hear you. Okay. I lost your audio. Let's see. While we're figuring that out, I'm going to go ahead and put up just a couple of these comments while you're figuring out what's going on with that. Okay. So Melissa says, thanks so much. This is such essential information, and I agree. And then we have Pam. And Pam says, hey, so Dr. Tony has dropped off, and we're going to just let him take the time to figure out what's going on with his audio, and we'll bring him back. And then Lisa Lopez says, thank you. God bless you both. God bless you, Lisa. We appreciate that. Pam, thank you for this. You are so welcome. I'm so glad to be able to do it. And I'm happy that Dr. Tony was able to join me. And we'll just wait for him to come back in. I do see Copper's Carnivore Kitchen saying, you're doing amazing. And I'm glad I was able to catch you live. Dr. Tony, thank you for taking the time to help all of us out as well. We need more doctors like you, Dr. Chafee and Dr. Baker. And then also, I just want to, oh, here he comes. Let me just bring him back in.
Yeah.
There you are.
I'll just leave the fancy stuff and just go to the computer.
Okay.
Sometimes
We
the
can hear
fancy
you.
don't work well, so we'll work with this.
Okay. We'll see how that goes. Thank you so much.
And by the way, guys who are checking us out, even carnivores catch stuff. So I'm a little nasal today because everybody in my office has been sick. So I don't get often. I get sick often, but it just got me this time. So
yeah, I caught a cold since I've been carnivore, and I was so sick and under the weather. My daughter's a PA. And I'm like, what's wrong with me? She said, Mom, it's rhinovirus. You have a cold.
That's right.
Oh, yeah. I forgot about those.
Yeah, that right.
It's a small C, not a big C. So
yeah, you're not going to be immune. But what's cool
right.
about carnivore is that you'll be able to recover quickly. And I didn't have to take any time off. Almost everybody in my immediate surroundings who got sick recently, they all had to take time off. So there's these benefits. But if you're a human organism, you are going to get sick sometime. You're surrounded by bacteria and germs, some of which do not like you.
Right. They want to try to take you out. Yes.
That's right. Trying to take you out. That's right.
So I think I heard you say that you are on like a ketovore or primarily meat-based,
yes,
with a very little bit of veg. How is that going for you? I mean, how are you liking that?
It's been, just imagine having problems with your stomach, and it impacts your ability to just show up for work every day. It impacts your ability to, have to look for a bathroom every day when you have irritable bowel. So now that doesn't happen. The only time I have problems with my stomach is if I cheat and I eat something I really shouldn't. And
Mm-hmm.
now all of a sudden my belly's hurting. Now I have issues with diarrhea. Now I have issues with gas. And gas is a very uh, not to be underestimated problem.
Right.
Right? So it impacts relationships, it
It
impacts
does.
your comfort level,
Mhm.
and but now I just don't have any of that. So for
Yeah.
me, it's been like wonderful, and I know we have more research to do. We have observational studies that show carnivore is a good idea, but we don't have randomized controlled trials. So it's a little bit of a how is it working for you? Are the labs? We have ways to measure risk for heart disease, cardiovascular risk stratification, stratification tools. So if those things still look good, then it's pretty much reasonable to proceed with that type of dietary pattern. A lot of docs do not feel comfortable with that, so they
Yeah.
just continue to follow the mainstream narrative of more grains and things like that. And
Yeah.
I just can't do what doesn't feel right for me. So I just don't think that's the right way to go. And so, but yeah, since I've done it, it's been, I don't have to think about eating. I don't have to think about, is my stomach going to be okay? I just kind of
Mhm.
exist now. And I have other things to focus on, like spending time with you and sharing this message of healing. So
Yeah.
I'm really loving it. And it's been wonderful for me.
That's awesome. That's awesome. Same for me. I was recently on vacation in Hawaii,
Yes, I
and
saw.
I decided that I would eat macadamia nuts
Wow.
because
Okay.
they're keto.
Those little
I was like,
charry things, I'm sure
oh
they
my
are keto, but how'd
gosh,
that go?
they tore my stomach
I'm sure they
up. I
did.
mean,
Yeah.
within 30 minutes, I was having gas and having tummy pains. I was
Yeah.
like, I shouldn't be eating this.
Yeah, for some people, like some people
So,
tolerate it, but those nuts and seeds and grains are charry to
yes.
your gastrointestinal tract. So for some people, they can tolerate it, but for people like
Mm,
you and me, we cannot tolerate it. So
no.
I love regular peanuts, but I'm gonna feel it later.
Yes.
I just avoid it, and there's so many other things to eat though. So it's not
So
that
many
big.
delicious meats.
Yes, things that don't make you feel bad.
Right, right. So, yeah, so IBS was one thing that you had. Were there any other personal things that happened with
Oh,
your
not at
going to
all.
keto?
Not at all. I was blessed in that I've always been a pretty healthy guy.
Yeah.
Mm, the things that it's more practical stuff. It's like, okay, as I look outside the office of my office window at clinic, there's a Subway. So I would go to Subway, didn't bring lunch, and I would eat a 12-inch. And I didn't know a 12-inch sub had 90 plus carbs.
Oh my
I didn't even know that was a big
God.
deal
Yeah. Right.
because I had my, vegetables on it, right?
Hmm.
So so now, and then I would have, baked potato chips. They weren't,
Yes.
they were baked, so they were
Right.
better. And
Hmm.
I don't think I was doing a lot of soda, but just those two things together probably got me into the 120s for carbs. But then what would happen is I would, I'd see 25 to 30 people a day. So I would get to the second half of my clinic and I'm like, it's 132. And I'm just like, patients are like, Doc, are you okay? Because I'm like just sleepy. Now
Yeah.
what I do is I'll eat which sounds like more, I would eat like a half a baked chicken, right? And when I
Right.
eat half a baked chicken, I feel nothing. I don't get that insulin spike,
Hmm.
sugar spike that leads to, I don't get. So for me, it was the more practical things, and you don't want to have a doctor in front of you at 2 or 3 p.m. when you're being seen with lack of mental clarity, who's not alert, making very impactful decisions about your care, but they're like not even there. They're, in fact, another thing that happened is I'd be waiting until it was time to, I knew I would leave at around 5:30 or 6. And I was
Hmm.
like praying the last few patients wouldn't show up just so I can get out of
Oh
there. So
no.
even
Yeah.
worse, because I was so tired eating that way, I would then go home and I'm sitting here at the lights falling asleep. It was very unsafe. So for me, it was more practical things. And
Yes.
when you're busy as I am, you don't really have time to not have maximum energy, focus, concentration, and sleeping in front of the patient. So all those things just disappeared. And I'm super
That's
alert.
awesome.
And at 55, I probably have more energy than the 30-year-olds in my practice. I know you had a recent guest who was in her 30s. I just saw that.
Yes,
Um, and
Ellie.
a person in their 30s should be full of energy, and we now know that they're not if they're not eating the right dietary pattern.
Totally agree with you on that. I mean, you know, myself, I work from home,
Hmm.
but when I was eating carbs, so I'm on a pretty much zero carb diet now. I
Yeah,
don't eat any vegetables because they don't agree with me.
I don't agree.
I've discovered. But I used to have that same thing. Like I would be so tired in the afternoon, I wouldn't be able to function. And I like you have to be able to function. I'm a program manager, IT program manager, and I need to be able to think because I have to be able to put all these little pieces together all the time.
If you're a
So
manager of anything, that is a crazy job. Like
it is.
our managers kind of run our health system, and
Hmm.
but they field all the complaints. It's just a tough job. They have to lead people, you have to
Yep.
motivate and inspire people. So yeah, you need to be on your P's and Q's. I mean, you just got to be on top of things. So I
Yeah, you can be tired in
no,
the
no,
afternoon
no,
and you're working with these global teams and people are just waking up and you're already tired. So yeah, so it's definitely beneficial from an energy perspective, I would
absolutely,
say. My
absolutely.
energy is through the roof and it sounds like you're experiencing the same
Oh yeah.
thing. So that's awesome. So, as a physician, what led you to metabolic health and functional medicine?
Well, again, some of it was just the frustration, but you don't know what you don't know. So
Hmm.
if you're a conventionally trained doc and you are good at diagnosing things and you are good at making sure people get the right procedure or surgery, you think you're doing a phenomenal job. I later learned that being a good doctor was a little bit bigger than that. Some of being bigger than that is just having some empathy and knowing how to talk to people. Like I literally have been in front of doctors who get upset that the patient's giving them a bad satisfaction score. We call it patient experience now. And I
Hmm.
tell them, being a good doctor, they assume that you're going to figure it out because you're a doctor. But they
Right.
also want to be treated with dignity and respect. So some of it was that, but the most of it, as relates to this topic, is related to I something was wrong. So I didn't realize I wasn't a good doctor until I got interested in nutrition. Then what I ended up doing is I learned that functional medicine was a little different. So I said I might as well do my nutrition and functional medicine together. And what they taught me is that there's a reason why everything happens, right? There's no such
Hmm.
thing as, you'll look up some of these medical conditions and it'll say uh, cause unknown. Well, I just
Hmm.
disagree with that. There's a cause for everything, right?
Yes.
And what functional medicine doctors do is that they try to find the root cause. So
Mm.
metabolic health became part of that equation because I learned that most chronic medical conditions have a metabolic cause. So
Mm.
now, and so if you look at your blood pressure as an example, and most metabolic conditions are rooted in your body making too much insulin. So
Mm.
logically, if you can do anything to reduce that insulin burden, you're probably gonna do better. So if we use blood pressure as an example, too much insulin then leads to retention of salt or sodium in your kidneys. And if you retain the salt in your blood vessels, that's going to increase the volume of the blood vessel, and then you'll have a high blood pressure. It
Okay.
also leads to insulin resistance, and insulin resistance will then lead to your body making less nitric oxide, whose job is to expand your blood vessels. So I could probably give an example like that for every medical condition that's chronic,
Wow.
including dementia,
Oh,
which is
wow.
3 diabetes. And you can imagine if it's called type 3 diabetes, it has something to do with being a high sugar, which then leads to too much insulin. It'll,
So the interesting thing then is,
yeah.
um, you know, you cannot be a diabetic, right?
Mhm.
And have high blood sugar, but yet still have these things that come from a high insulin, right?
Well, right. Yeah, that's interesting, right? Yeah, you can have uh exactly, but your body is brilliantly made. And for the religious people out there, they probably know why, right? So,
Fearfully and wonderfully
so,
made.
right, so there is a point, however, where you will have the impact of too much insulin, but maybe it hadn't really, maybe the islet cells, which makes insulin in your pancreas, are keeping up to the
Mm,
extent they're just making more of it to keep up. So now, if I measure a fasting insulin level, that's not the perfect test, but if I'm at the point where I have hypertension and maybe I'm at risk for other things like dementia, well, you'll know that diabetes is coming because you did a fasting insulin level, and that level is going to be super high for people who are going to move towards
mm,
diabetes. So it just takes longer. It could take up to 10 years of a high insulin state before you become diabetic, which is why everybody checking out this episode should have their doctor get a fasting insulin level. Not a
mm,
perfect test, but if your doctor says I'm not going to do that, then you may want to reconsider who your doctor is, because why would they not do that? I mean, you're just asking, you're saying, hey, I have evidence that this is important. Would you please order that test for me? And there are ways to order tests on your own, but you
mhm,
should work in collaboration with your doctor. Say, hey, I'm very interested in this, and I understand that there may be some issues. I want you to order that test for me. And if that level is high, and we want it to be less than 10, preferably
mhm,
like a 3, 4, or 5. But if it's high, that means that your body is making too much insulin, which puts you in that hyperinsulinemic state, which puts you at risk for metabolic syndrome and all the medical
mhm,
conditions like the blood pressure, the diabetes, the increased, lipids, the dementia, the cancer, the polycystic ovarian, and all those conditions that follow. But most chronic conditions are inflammatory in nature. And with this type of hyperinsulinemia, you're going to cause inflammation, and macrophages come in and
mm,
hang out and start a party, and it's not a good party. You don't want to be in that party. So once you understand that that's the root cause of your stiff arteries for hypertension, then you're like, okay, I can take this medicine, but I never got to the root cause.
mhm.
Thankfully, if I change my diet, I will reduce the insulin spikes. If I learn to manage stress better, I will reduce my insulin spikes. If I make sure I get enough sleep, I will reduce my insulin spikes. That's why if you get maybe 4 or 5 hours of sleep the night before a doctor's visit, it's likely that you're going to have a high blood pressure when you go see the doctor.
Oh, wow,
One
that's
night,
very interesting.
yeah, it's very, and it's so I think we need to think about, that's why I have think about the entire person, which is the functional
Mhm,
model. What led to these things? Was it
right.
you had a bad conversation with your spouse the day before? All of these factors then help us to know what to focus on to be healthy.
Awesome. Thank you so much for that response. So I'm going to just do a couple of these, just so that people, I want to appreciate them being here. So Rhonda Townsend, hey Rhonda, Rhonda's going to be on my Women of Wisdom podcast. I'm calling it a podcast. It's not a podcast. It's a live stream
Yeah, well, hey Rhonda,
in a
let's do
couple
it.
of weeks.
Do it.
And then Plum says hello. Um, so this is Becky. I think her name is
Mhm.
Keto Oregonian. I got her name last night. She said she had her fasting insulin tested. It was 7.8, A1C 5.2, and fasting glucose 80. One thing, my labs that bothered me was a score of 17 on CO2. Last year, 33. Thoughts? She doesn't have a doctor right now.
Right, okay. And so she's trying to, I mean, when you look at the fasting insulin, I like that. When you look at the A1C, I like that. When you look at everything else, it seems like she's doing pretty good. So, and then she had carbon dioxide that was a
Mhm,
little off, which means that she looks like she's a little on the more acidic side. One of the things that's challenging is to uh, manage your acidity in your blood, because your body is going to really make it very difficult for you um, um, to adjust that. So a lot of people do things like alkaline water and things like that
mhm,
to make that, to get that number. into a range that's less alkaline. So that's the first thing I would kind of suggest is something people need to be thinking about. Um, Now, but there's so many reasons that um, when I think about an elevation, it kind of you think about um, like some type of something may be going on where we need to do some further testing. And it's not a easy, quick, let's figure out what this is just by hearing what she just suggested. I think it's going to require a little bit more evaluation. The first thing I always tell people um, is to think about, are there things going on in your home that would increase the carbon dioxide exposure? That's what you want to start thinking about. Am I having issues with my lungs that would suggest that I'm not able to move the oxygen properly? For example, if she had had a history of smoking, and would she be at risk for COPD? Because I've seen elevations in that just from having COPD. So I would want to um, I would want to get tested for things like that
Mhm.
to better understand what the cause is, because it's not when you're out of range for any reason, you start thinking about these things. But if she's not short of breath in any way, or if she's not fatigued in any way, it probably isn't that. But I would start, trying to connect those symptoms to a possible cause. But I think
Mhm.
about lung stuff. People who are obese even tend to have more problems with this. And as they lose weight, they tend to have less problems with that. And so I think those are the things I would do, but it does require further evaluation really to get a sense of what the cause is. So it's not a quick and easy answer, but
Yeah.
further testing is recommended.
All right, Becky. So let's try to find a doc, somebody to help you out with this. All right. So my next question is going to be, so in your practice, what are your primary concerns when it comes to what you're seeing and the health trends are happening right now?
Yeah, man, I'm an optimistic person.
That's
And
good.
just I'm gonna say out loud that one of my areas of focus besides metabolic health is health equity and trying to make sure everybody has access to care. So the first thing that comes to mind with that question, um, I want conventionally trained doctors, as I've suggested earlier, to spend more time on understanding the root cause of why people are sick. So if I have a young lady in front of me. I tend to take care of adults now between 18 and up, although I am a family doctor who was trained to take care of babies and deliver babies. Just don't do it anymore. Um, so if I have a person in front of me who has ovarian cysts, I would want a doctor to not just prescribe metformin, right? Or not
Mhm.
just prescribe metformin and say you need to lose weight. I want that doctor to help them lose weight, but understand that that polycystic ovary problem probably came from hyperinsulinemia, and give the patient the tools to reduce the hyperinsulinemia. The other thing I would want to see in healthcare that, and I'll be honest, Advocate Health is moving towards this model, which is why I'm still in this health system where I work in
Mhm.
Illinois, but we're also in Wisconsin, North South Carolina, Georgia, and Alabama. The other thing I want health systems to do, which we've started doing, is address the social determinants of health. So if somebody is in front of me who's struggling, I need to know that they're financially unable to eat the food that we want them to eat. I need to know that they live in a neighborhood where they have food insecurities. I need to know that they don't have social connections. And as you know, if we don't have social connections, it's easy for the carnivorous grandma because she got like a tribe around her, right? But what if
Right.
I don't have that tribe?
Right.
Do I have any housing issues? Is my education at a level where I can even understand what a carb is or what metabolic health is? So those are the things I want to see. I am starting to see that, but it's going to require people in health systems who see the world through this lens, and that's probably uh, gonna. It's like a grassroots. It's like in politics, right? When Bernie Sanders ran, grassroots, right?
Hmm.
You have to have
Right.
grass efforts, just like this low carb, keto, and carnivore. This is a grassroots effort, which is why we got to
Yes.
always do a shout out to Carrie of the
Yes.
Stead How.
About time Carrie got mentioned.
Yes, yes, I got to mention Carrie again because
Yes.
everybody should go to the carnivoredietmovie.com
.com. Yes.
and if you can contribute, because we need to level the playing field and give people an option that will, in many cases, save their lives. So it's grassroots effort, and so I'm trying to do it in the health system, but we're going to continue to use this platform and podcasts and going to speak at conferences and things like that until the mainstream kind of wakes up to the idea. So thank you for sharing. You're so fancy. Thank you for sharing. You do
Try.
better than me. I'm still learning how to use these live streams. Okay. So please,
So
please,
Carrie
please.
was how I found you. I
Yeah,
saw you on
yeah,
one of his, I don't know, many live
right.
streams.
Yes.
And I said, I've got to talk to this doctor.
Yes.
As the carnivorous grandma, as Robin Heron, carnivorous grandma, I'm
Yes.
very concerned about what I'm seeing in African American and people of color
Yeah.
community
Yes.
regarding metabolic health. And there's so many diseases even within my own family, and I'm like, how do we address this? The voices are not out there that need to be speaking. We need to be talking loud out
Yeah.
here
There are
about
voices
better.
out there. It's the wrong voices.
Exactly.
Misleading us a little bit. And so I think we need to balance that conversation for sure.
I agree. I
Yeah.
agree. So, thank you for shouting out Carrie. I will always shout him out. The only reason that I have my YouTube channel up and running today is because of Carrie's encouragement. And he encourages us all to
That's
start a
right.
YouTube channel and start talking. I think it was Dr. Kilt that said to him that it's these examples, it's all
Yeah.
of these examples
Yeah.
that matter.
That's
So
right.
your story matters out
Yes.
here as a voice in the carnivore community, or even in the primarily meat-based way of eating community. Your story does matter, and and so I want to talk to you for sure.
That's right. You better know it.
All
That's right.
right. So why do you think it is that we are seeing such a push toward vegetarian and vegan diets? Uh, I'm particularly concerned with African American and people of color,
Yeah.
and but certainly all across our culture, there's a huge push toward being a vegan.
Yeah. Well, we want to reach everybody. And as I look at the people who are chiming in, Nurse Kim, Ketovore, I'm not even gonna try to pronounce that, but you know what
Becky, that's
Becky,
Becky.
yes. But they're not even African American, but so we want to reach everybody. But the reason why
Exactly. Yes.
myself and carnivorous grandma are important is because we had the Black carnivore who inspired us, and she's kind of on hiatus right now. But there's not enough people of color who are teaching this message, and most of the mainstream messages I see on YouTube from people who look like us are very mainstream and not necessarily open to this approach. And the other approach seems to not be as effective from what I've experienced. So going back to the African American messaging, I personally think the biggest impact, which pushed us towards thinking the vegetarian approach was the best, was from Dr. Sabi. So many
Hmm.
of my
Hmm.
patients, they bring up Dr. Sabi. I think his last name was Bowman, and I do like the fact that he pushed us towards a holistic approach, right? And I know he was struggling with medical problems, his vision, and he eventually was frustrated with the conventional model, which we've all been frustrated with. So he became a herbalist and learned using herbs and things like that. But ultimately, the messaging, which I agree with in terms of eating real foods and things, but the messaging that meat is harmful is totally off base. Meat is not harmful. So for those who follow that, that's okay. But to suggest meat's harmful when in Hong Kong, people live the longest and they average, basically 20 ounces of meat per day, which is like 2 10-ounce steaks, and they
Yeah,
live the
wow.
longest. So you can't say meat's the problem when you have
Mm,
data like that. So I think that his messaging is the main reason why people are following that approach. And they don't have a lot of people like ourselves who are countering that narrative. What I would tell people is if you eat a bowl of quinoa, which is a highly respected grain, which
ancient grain.
yes, right. Got issues though. So if you eat that and your blood sugar doesn't change, then eat it. But I
Mm,
guarantee you your blood sugar is going to change.
right.
Now, so
Mm,
I mean, I'm speaking particularly of people who are vulnerable. So I think, and I made a video recently on YouTube about what's the best way to know that you have, what's the best way to know what to eat, and the answer ended up being, spoiler alert, a meter. So if your meter says when I eat that quinoa that my blood sugar spikes, then why am I eating that? Right? I don't care what they say it has in it. They'll have it give you a list of nutrient benefits and oxidants and all of this stuff. But
mhm.
if it raises your blood sugar, then leading to hyperinsulinemia, then that's not a good choice. So I think that's how I frame it. I think Dr. Sabi and his messaging and others, and of course, when you have large organizations that push us toward that narrative, that'll then filter down to the doctors and the nutrition professionals, and they're all messaging the same thing. But what they fail to do is to say, I'm giving these people this advice and they're still not healthy. They're still diabetic. They're still, and we like this person with diabetes, right? When I want to say diabetic, I'm just trying to break that habit. But
Right, right.
listen, they're not better. If you have clinicians down the road like Dr. Eric West and myself and others who are getting people off medicine, off of insulin, and
Right,
you're then saying that your approach is better, I would want any doctor to pause and say, man, maybe there's something to what they're doing.
right.
Is saturated fat still an issue? Should I look this up and do more research instead of following
Mhm.
a narrative that has not resulted in the kind of reversal of chronic diseases that we've seen?
Yeah, I mean, literally, it's only been within the past, I think, couple of years that I've even heard that diabetes can be reversed. It
Yes.
was literally a chronic, you're never going to be done with diabetes, and it cannot be reversed. And only over the past couple of years have I heard that it could be reversed.
Yeah. When I wrote my book, Fix Your Diet, Fix Your Diabetes, I did put your dietary approach to reversing. And I put that in highlights. Now,
Mm,
when I first thought to do that, uh, I really wanted to say curing, but that was too strong. My editor said, no, don't say that.
right.
And then that makes sense because you're not supposed to say that. So that's fine.
Yeah, yeah,
And then I
okay.
guess reversing is better because what we say to people, if you maintain a dietary pattern we're suggesting, then it will stay in remission, at least we can use that term, until
Yes,
you go back to the dietary pattern that leads to insulin spikes. So for me, uh, I did not learn that that was possible. It was a chronic medical lifetime condition. But
yes.
I've met people 5, 10, 15 years on insulin. One of my previous videos was with Gwendolyn Butler, who was a medical assistant at one of our Walgreens clinics in the US. And she had been on insulin for at least 10 years. And she was able to get off insulin within like 2 to 3 months at least. It was not,
Amazing.
and she was shocked. And she was shocked that nobody told her that was possible. And
Right.
so we just want to provide a lane for people to get into who are tired of taking medicines, who are tired
Yeah.
of the copays and the strips average about $1 a strip. So even if you have insurance, do we really want to spend that kind of money on some testing strips? Do we really want to be a
Right.
pincushion if we don't
Right.
have to be a pincushion? So
Yeah.
I'm providing hope. And for those who are type 1 diabetic, like my wife, and when you lose 12 years of life on average as a type 1 diabetic, which is a shocking
Mm,
stat,
that
I
is.
want to make sure I need those 12 years for her to drive me crazy because that's what she gonna do.
Absolutely.
I need her to be
100%.
here.
Absolutely.
That's right.
Absolutely. Yes. So I do have a question here in the chat from
Yes.
Plum. I'm going to put it up on the screen. Plum wants to know if you can talk about menopause and carnivore, please.
Oh man, I would say keto or carnivore is amazingly suited for menopause because it's all about hormones. And what we found is that if I have so many patients who have adopted a keto or carnivore diet, and their hormones just kind of stabilize. But keep in mind that a lot of the cholesterol and those types of things that are important for your hormones are necessary in your diet. So if you go on a low fat diet, you're more likely to have more problems with menopausal symptoms. So I do see not everybody's different. And I always tease my female patients saying, "You're too much woman. Your hormones are just, got
That
too
must be
much."
me. I'm over here sweating right now.
Yes, but what we found is that you're too much woman, and that's okay. What we find is that people who do a lot of people do much better. So the question is, when people are doing these dietary patterns, would they have done much worse if they had not adopted those patterns? And my answer would be probably so. So I would encourage somebody to at least do the experiment. There's so many reasons to do these diets, but you want to do an experiment to see how your body responds to this dietary pattern. And for most people, the answer is that they're going to do much better than they had done otherwise.
I do agree with that. I'm in menopause. Thank you, Jesus. But I still have a lot of hot flashes. My
Right.
hot flashes are crazy, but they're not as bad as they were before I started carnivore.
That's right.
So my
That's
mom was just asking me about that, or my daughter, somebody was asking me, and I said, as I think about it, I have less hot flashes than I
right.
did before I started hard carnivore.
And we'll work
So
with that. We can work with that.
I work with it. All right. So Lori, I'm going to put her comment here. She says, I'm an African American female and my diet is meat based. My family is deeply opposed and stuck on SAD diet. Any suggestions to get them to open to this way of eating?
Well, it depends on, sometimes you have to ask them what their concerns are. Um, but what I would say to them is the following. The carnivore is a version of the low carb and keto diet. And the low carb and keto diets have been endorsed by the American Diabetes Association. They have been endorsed by the
Quietly.
very quietly. In small
Yeah.
print, that's
Yes.
funny. Yes, it's like at the end of the drug commercial, or they say it really quick. But,
Uh-huh.
the American Heart Association has endorsed it, and when the American Heart Association endorsed keto, they said, "It's so effective, you have to be careful
Mm,
because the blood sugars will plummet." But that's what you want. You just gotta get off the medicines while they're plummeting.
yes.
The Society for Endocrinology has endorsed it. So the three major societies that did not endorse it maybe 5 or 6 years ago, they all have done that. So the first thing is that it's mainstream now. And then if it's carnivore specifically, they do have a observational study that was done. And when they did that observational study, they found that everybody got better with this dietary pattern. So part of it is just say there are respectable organizations that are endorsing it, and
Mm,
I think that you some people just need a little science. But the most important thing I tell people is not what the other people are saying; it's your personal testimonial. So if I say to someone that before I started eating this way, I had a stomach that was so easily upset that I literally almost missed my medical school graduation because of it. I got,
Wow.
they called my name and I wasn't there because I was in the bathroom.
Mm-hmm.
Um, if I can do something to not make that happen again, would you not endorse that? So you take your personal testimony and you say to them, I definitely understand your concerns. I only ask that you support me because since I've been doing it, here are all the things that got better. And as long as those things are getting better, I have to do what's best for my body. Uh, and and that's what I would do. But I also think people have to just stay in their lane and and not make that the topic of the conversation. And we'll migrate towards other topics because I think adults should be allowed to be adults, right?
Mm-hmm.
I don't think in any way should we live in a world where uh, like in New York, we should not be telling people what to eat on Fridays and Mondays. We should
Right.
we should educate them if we think that's what's necessary about dietary patterns we believe are better based on the mayor who's more plant-based. We should never force them to eat something that they don't want to eat because if I were to make it carnivore Monday and Friday, that would not be good as well.
Right.
That would not be acceptable. So why is it acceptable to do it the other way? So we want
Right.
this is America for those who are from America, and we
Yes.
want to give people choice while
Mhm.
also educating them based on what we think is best for them.
And I was interviewing Ellie last night and appreciated having her on. And one of the things that she said was, we don't force anybody to do our way of eating. We give them the information and allow them to make their own choice.
That's
And
it.
that's what we have to do is, if we're forcing people to do it, then why? You know, what are the motives behind that? I don't know.
That's it. That should be very logical. That's just what you do for adults. Me and my wife,
Yes.
we it's been a journey for us, and I share my opinion. She does her thing. I don't go to dinner with my family and tell them what they should be eating. But if they need my help, I provide that guidance.
Same. I mean, I just have been talking. I've been talking about it. And if people have questions, I'm more than happy to answer them
That's
and direct them to somebody who's more knowledgeable than me, like you,
right. Right.
definitely. Because, I'm not a medical professional, but I know the benefits that I've seen.
That's right.
So I will answer questions and I talk all about it on my YouTube channel.
That's right. You better know it. That's what it's all about. So for those who are following myself on my channel, you have somebody else you can now follow, which is the carnivorous grandma, because she does stuff I don't do. She's like showing you what she's eating and they're traveling all over the place. So I think
Oh
it's
my
fun to
gosh.
walk with somebody who is on that journey. Absolutely.
Yeah, I'm on the journey. I'm definitely on the journey. So Nurse Kim is saying that she agrees. She's very interested in facilitating African Americans receiving the message. This is so important. As I looked around and I talked to Dr. Tony about this, I looked around all over and could not find anybody in my community that was talking. And of course, we talked about the Black Carnivore who is amazing and we miss her and we hope that she comes back soon
Yeah.
and restarts her
She knows so much more about
oh my
carnivore than I
gosh.
do. She's just her knowledge is off the chain. But
Yes.
again, self-care, do what you gotta do. But when
Yes.
she comes back,
Yes.
we'll welcome her with open
Absolutely.
arms
I mean, I looked for her and I looked for others like her and I didn't find anybody. So here I am,
yeah, yeah.
and to God be the glory for that. But Nurse Kim, I would love to chat with you.
Yeah, Nurse Kim is making great points, and we
Yes.
you don't have to be a African American person or doctor to impact the lives of people. You want to be empathetic, and you want to
Yes.
understand that people may struggle for reasons beyond their discipline to do a diet, and there are so many reasons why in communities of color the struggle is different. And some of it is just a chronic stress that exists in communities of color. Those stressors can exist in any community. But
Yes.
if I live in a neighborhood where gunshots are common, hearing the ambulance and the cops is common,
Right.
having a multitude of family members creating drama, etc., I'm likely to have a harder time And what we want to do is, when it comes to health equity, we want to live in a world where we recognize, we want Nurse Kim and others to know, this person in front of me may be challenged in ways I hadn't thought about. Let's dig a little deeper and then give them resources that allow them to get through the challenges they may face. I always use the example, because I used to deliver babies, of the infant mortality rate and the risk of premature delivery is much higher in women of color, 2 to 3 times higher than it would be in a Caucasian woman. But they also find that if you give that person support, community, and things of that nature, you can actually level that playing field. So by simply having within a health system a system of support for people who need it, you may then increase their chance of having a healthy pregnancy for them and their baby. So just little nuggets of information level the playing field, and you want to provide resources for everybody. But you
Right.
really need to understand, when people struggle, do not, demonize them. There are
Hmm.
reasons, and who really doesn't want to be healthy?
Right.
I think we all do. And if we struggle and people don't understand why we struggle, we become frustrated, disenfranchised, and we may not feel the health system is going to make a difference for us.
Right. Oh my gosh, such a lot of great comments in here. Let's see. I We're going to be almost out of time. It's like 4:14 p.m.
We'll go a little bit
So,
over, but we'll work it out.
okay. Okay, great, great, great. So, let's see. What have you seen in terms of people's ability to adhere to these diets? As you're talking about people's challenges.
Yeah.
And have you seen any difference in the ability to adhere to a low carb or carnivore
Yeah.
diet?
You know, carnivore is easier for most people. Again, I was plant-based previously. And when you think about a doctor telling a patient what to eat, with carnivore, I'm saying you can eat your meat, you can eat your fish, you can eat your eggs, and you can eat your dairy if that's something you tolerate. Um, it's easier than saying to them that they can't eat those things. So when I was more of a advocate for a vegetarian diet, I found it was much harder. In fact, it's not even a comparison. In my clinical practice, I am advocating low carb generally. And then, depending on who's in front of me, I'll say you may do better with carnivore. People who have autoimmune diseases,
Mhm.
people who have neurodegenerative diseases like MS, or just anything dealing with the nervous system, obviously epilepsy, and people who struggle with, mental health is particularly challenging. So if a person's bipolar, schizophrenic, or something like that, they may benefit. ADHD. So those are the ones that really benefit. And then, but I kind of ease them into it. Maybe we move towards a keto approach first. And then for those who want to take it further, after they've done their, I call it, they kind of remove all the bad things, and they start to add back. That, depending on how they respond, will depend on what they land at. But yeah, it's
Mhm.
much easier. It's easy to tell a person to go home and eat a ribeye, when the rest of the world's been telling them not to eat the ribeye, take the
Right. I'm
fat
gonna
off,
bring this up.
lean
I'm
meat,
gonna,
and things like
yeah,
that. So
yeah.
absolutely.
I'm just popping this up here because it's right what you're talking about right there, right? This year, I will says,
Yes.
my brother's a type 2 diabetic with kidney problems. His doctor told him not to eat too much protein because it's too hard on his kidneys.
It depends on to what extent. There is a point where your kidneys are so weak that they can't handle the high protein. Um, when you're in the early stages, normal kidneys, early stages, mild, maybe even up to moderate, uh, the protein, I think, is beneficial. Now, what I would ask that person to look up and share with the doctor is Dr. David Unwin in the UK. So David Unwin, and Dr. Jen Unwin, um, they have a 7-year study, and it was low carb for diabetic people with diabetes and kidney problems, and it showed marked improvement. So when I see people who are concerned about their kidneys, my solution is a low carb, keto, or carnivore diet, because the question is, going back to what's the root cause. So let's go back. Well, why did my kidneys fail in the first place? Most of us know that diabetes is the number one cause of kidney failure. Well, why is
Mhm.
diabetes the number one cause of kidney failure? Well, because of that blood sugar being high that causes glycation, and that glycation is basically sticking sugar to the you know tubules of the kidney, causing damage. So a logical person wouldn't say, let's just take a medicine like an ACE inhibitor that'll protect your kidneys. A logical person would say, let's get rid of the poison. So if you get rid of the sugar being high, your kidneys in many cases are then given an ability to recover. And when you allow them to recover, the kidneys get better. So I think it's to what extent. When your
Mhm.
creatinine is really high in a 3 and 4 range, that may be a little bit more challenging. But for the most part, this approach is helpful. But I would get that study first and then have a conversation with your doctor about, okay, to what extent is if your creatinine is like a 1.3, 4, 5, a 2.0, my belief, and this is not medical advice, my belief is that that's not at a level where you should be worried. I think it would actually improve your kidney function at that level.
Mhm. So I do have a couple questions.
And I
My
agree with that
mom,
last statement.
yes, let
Keto is
me put that back up there.
Yeah, keto is not high protein. It's moderate
Yeah,
protein. It's more high fat. So totally agree with Nurse Kim.
yeah. Thank you so much. My mom had a question, so I definitely have to ask her question.
Amen to that.
She wants to know, she's having numbness in her feet and toes, and she wonders if that can be helped by a carnivore diet.
Yeah, well, there are many reasons for a neuropathy pain, which is what we call that. First thing I think about in my functional medicine training, I learned that if you're going to supplement, you want to start with things like the vitamin D,
Mhm.
the B vitamins, and a turmeric. Now, the turmeric that I recommend that's the most potent is a company called Meriva, Meriva. There's a metabolite that's connected to the curcumin or turmeric, and it makes it 29 times more potent than anything on the market. Now, of
Oh,
course, if you're
wow.
on turmeric, you got to be careful. There is some blood thinning with turmeric, so if you're on blood thinners, you may want to avoid that. That includes aspirin. Now, having said that, most people who get neuropathy, there's so many causes. So some people end up getting a electromyogram, an EMG, where they put the little probes on your toes, and they can determine if that neuropathy is from your back. So if you have a disc pressing on a nerve, that's different than just inflammation on the nerve. Now, if it's inflammatory and the nerve is just irritated, a carnivore diet would be perfect because you eliminate the things that lead to the inflammation would tend, again, going back to hyperinsulinemia, then that sugar floating around, glycation can glycate nerves and irritate the nerves. And so if you give it a little bit of a break, over time, that should get better. So I would consider supplements. I would consider, let's see if this carnivore diet with the reduced inflammation helps. And ultimately, if you're not getting better, that's when you want to get like an EMG, maybe get an X-ray of your low back, see if there's a disc issue or something else
Mhm,
causing this.
mhm,
But oh, one more thing: if you're transitioning your diet, let's just say your sugar had been high and
mhm.
you're now going low, your body still will not be happy for a while because your body likes to
Yeah,
be in a homeostasis environment. So if things are changing, even if it's for the better, it'll irritate it for a while until
yeah.
things settle down.
That's a
Doctors,
great point
yeah,
because my mom just started a
yeah, it may
carnivore-ish
flare it up. So
just
she may have to
about
just
maybe
hang
2
in
weeks ago.
there,
Yeah, hang in there. Okay, I'll wait.
supplement until it
I'll
gets better.
definitely
Yeah.
try. That's good. So Nurse Kim is a little bit curious and confused about the turmeric, and I sort of had a little bit about the same thought about
Yeah.
spices in
Well,
general and
this
turmeric
is
in
this is the
particular.
problem. This is the problem. Everything about oxalates is correct.
Mhm.
When you're in a carnivore community, the idea is that you avoid plants, period, right?
Yeah.
I consider carnivore the answer, low keto the answer. However, I have seen that when people are transitioning, the benefits for certain specific supplements under certain circumstances may justify it. For example,
Okay.
so if I, for example, one of the things that is on the list of things. I had a podcast, which was a lecture with Dr. Merrick, Paul Merrick, and he talked about what do you take as supplements if you have if you want to prevent cancer or if you're treating cancer. One of them was like green tea extract. So the question is, if I'm a carnivore, should I avoid that? Maybe. But the point I'm making is there are many things you have to think about in terms of tolerance. So if I'm a carnivore or a ketovore and I'm thinking, oh, I have this specific issue that may benefit, and it just happens to be some plant substance, right? You may want to do an experiment to say, well, let me see if I take this, what happens, right? And if I take something that has been clinically proven in studies, now, of course, these are not carnivore studies, so
Right.
you got to keep that. That's the caveat. These are sad. They're comparing the standard American diet to a great supplement. If in that
Mm-hmm.
setting, I find that I tolerate it and I may then get the benefits of reduced risk for cancer, that's when you can find that that may be worth doing. One thing you don't want to do is to assume that carnivore will fix everything and that we got to
Mm.
eliminate everything else off the table. We're trying to find a good sweet spot for you, your family, and others, particularly if you're a nurse, that'll help. But you just want to have that in your toolkit. My hope is that for most of us, we don't have to take supplements. Like, do I take supplements? I do. I do electrolytes.
Mm-hmm.
I do vitamin D and I
Mm-hmm.
do omega-3 because I do not eat enough fish. I can live without seafood. I just can't. So I take those specific things, and if periodically I'm exposed to things that have plant-like substances in it, and it doesn't bother me, I think that's okay. So we want to be careful not to uh, go down the rabbit hole of everything that's from the plant kingdom is bad, but your body will answer that for you anyway.
Yes. It will. It absolutely will. I tried broccoli about maybe a month and a half in. My hand eczema broke out.
Yeah,
Gassy, and I'm just like, it's just not worth it.
yeah, yeah.
So,
Broccoli does
uh,
some tricks to me as well.
yeah.
Yeah,
Okay, I think I mean we're an hour and 7 minutes,
yeah.
and I definitely appreciate all the time that you have taken to answer these questions and to be with me today. I have some more, so I'm gonna have to invite you back
Oh yeah, well,
again.
that's fair, and I'm just happy that I survived. My voice hung in there. Uh,
It did.
I'm worried
It
about
did.
Monday is going to be tough because I have to see patients,
Mm,
but I saved my voice for you. I tried not to
thank
do a lot of
you.
talking this weekend, and I knew I wanted to maintain this commitment, but I just feel blessed to have earned the knowledge. I'm still learning,
Yeah.
and that people out there like yourself are spreading this message. I think everybody who's checking us out tonight should really understand that you play a great role in helping to heal your family, yourself, and your
Yes.
community. This is a grassroots effort, so you want to point people to resources that will help them. They may not listen to you. My mom doesn't listen to me. And I'm supposed to be the expert, right? So
Mm-hmm.
family doesn't always listen. But I encourage you to get a link tree. A link tree is free. On that link tree, put the influencers that you feel comfortable with. Myself, the carnivorous
Mm-hmm.
grandma, Russ. I saw Russ.
Hey, hey, Russ.
Yeah, homesick
Meant to
Buckeye.
mention him.
Russ, put him, and then you'll allow others to then message this to them. And if they are not ready, then that's okay. It's just that you want them to have awareness of what's possible and that they don't have to live with chronic medical conditions for the rest of their lives. And when you're faced with a doctor who tells you that I can't help you, your kidneys are going to fail eventually. And then you have another group of people saying, we see it being reversed. In that moment, you should say, well, man, I might as well roll my dice with the people saying it's going to be reversed because you can't, at
Exactly.
least you got a chance. So and be critical of myself, of the carnivorous grandma, trust but verify. And as you learn these messages, just add it to your list of things you can consider and learn and grow. Because think about it, Dr. Saladino, hardcore carnivore, now he's eating fruits and honey, right? Because
Right.
this brilliant man evolved, and we did not kick him out of the carnivore community. At least I didn't,
Right.
because he felt that that was better for him. So be open to understanding that you're not gonna be the same person you were 5 years ago. But I
Right.
guarantee if you stay on this healthy living metabolic health path, you're gonna be so much further along, and you're gonna probably spend more time on this planet, giving you more time to share this healing message.
Thank you so much. Can you just tell us just a little bit about where they can find you? I know that you have Protecting Your Nest,
Yeah.
so can you just tell us a little bit about that before we let you go?
Yeah, the YouTube channel is it started off as a way to put the podcast in another platform. And then I would sometimes have guests like yourself. And then I would say, okay, how about if I make a video short with that guest? So that's 2 videos. And now what I'm trying to do is to make short video shorts like the one I just made about the blue zones, right? Those videos allow you to learn what you need to learn. And it's really, and I see the video with Russ, who was my most recent podcast, and the Blue Zones video. So check those out. And if you have something that resonates with you, that's one place to go. You can actually listen to the podcast on the podcast apps, et cetera, Spotify, et cetera. And on my link tree, so if somebody searches Dr. Tony Hampton link tree, they will see a link tree which allows you to get links to things like I have a handout. Yep, there you go. Metabolic health. You're really good at this. I'm impressed. So if you look at that link tree, the YouTube channel, but then there's favorite products that I endorse. That's just more support. That for diabetics, that fourth option. Another great channel is the Beat Diabetes channel. So if you click on that fourth option, that is Dennis Pollock, and he has 15 videos that are perfect for diabetics just getting started. And he's
Mm.
awesome. The video with the black carnivore is right under that. And that's a video where a person starting carnivore can hear from the black carnivore, A-Day Fox. That handout that's below that is an opportunity. Eat this, don't eat that.
Oh,
Raisins and
nice.
craisins, don't eat those. But you may want to eat the protein and a non-starchy. And then, of course, how to adopt a low-carb diet for those who are not ready for carnivore but want to do low carb. And then, of course, other links that follow. So I really appreciate you
Mm.
sharing that. And
No
I hope that
problem.
for those who have not checked out that link tree, and then it'll give you an idea of what you may want to share. Again, the link tree I have is a paid version because it has a little bit more with the images and stuff. But if you want a basic version, get a link tree, share the people who you feel will bless your friends and family, and then start
Yes.
to grow. Sometimes instead of preaching to them about what they should do, you just say, you should check this out. Check out this video. And then you go from there.
Yes, I will be getting my link tree. I did start one, but I'm gonna be getting it up and going.
Yeah,
So now you've encouraged me. So
that's right.
thank you
I'm your
very much.
coach today.
Thank you so much. So, I just really want to appreciate you, Dr. Tony, for coming on. I can't thank you enough for being a voice in this community. It's on my heart, truly, and I really feel a calling to talk about this and to share our stories and to talk to our community as well as anybody else who will listen
That's right. That's right.
about another option. another alternative. And so I really thank you so much for joining us. And we'll see you guys next time.
Everybody take care and thank you so much. Appreciate it.